Yeah, I'll start with hepatitis. This is the shortest topic, and then we'll move on to cirrhosis. Okay, so there are, for the exam, we'll only discuss the 5 most common types, which are hepatitis A, B, C, D, and E. So all are caused by viruses. They are infectious. So questions on the exam, if you've not looked at the final blueprint yet, it will include the cause, how it is transmitted, meaning some of these are transmitted via the oral fecal route, meaning foodborne illnesses, okay, through the mouth, and food and water contaminated with feces. Take note though that when we talk about oral fecal route, do not constrict yourselves to just eating or drinking. It will include oral sex. Okay, so let's say with oral sex, that will let's say if the male performs oral sex on the female anatomy is high risk for UTI, right? Why is that? Why are females again high risk for UTI?
Proximity of the anus to the vagina.
All right, so the same, yeah, it will apply to hepatitis transmission, okay? Because there are microscopic fecal material around the vagina because again of the anatomy. So don't just pick an answer that says food or water contamination, okay? So it will include oral vaginal sex, all right? If that's one of the choices, then pick that. When the transmission involves oral fecal route. So table 43-4 is a summary of the diseases, hepatitis A, B, C, D, and E. Now, the acute forms involve A and E. Okay, so here similar to A because they are both transmitted through the oral fecal route. So they have an acute form. The others, B, C, and D, are more chronic in nature. Okay, as described here, may occur without symptoms. Same thing for C, and then same thing for D. So the acute forms really involve hepatitis A and hepatitis E infection. Now, the course of the illness will also be similar. The only main difference between hepatitis A and E are really the countries where you can get E. Meaning, yes, they will have similar countries that are likely to spread the virus, but there are a few only that you'll see E in, meaning some countries are not likely to have hepatitis E transmission. Okay, so they're not all discussed in this page because this is just an overall. So as you go through each page, you go to the next page, this one discusses hepatitis A, how it is transmitted, the manifestations. They're typically the same. So for A and E, since they both have an acute form, meaning an acute disease condition, so the patients with hepatitis A and E manifestations will be the same. So since these are acute symptoms, they are the following. So anorexia, there'll be pain, of course, in the right upper quad because the liver is infected. And it will be tender. So besides the abdominal pain, there will also be nausea, heartburn, flatulence. In severe cases, the patient will turn jaundiced, meaning there is now more serious infection of the liver and indicates severe inflammation of the liver. And disease condition can last, well, it will vary whether or not the patient seeks medical attention. So if they come in sooner, then the symptoms will subside sooner. If not, the disease or the infection state can linger for weeks. So part of the question is to prevent the transmission. Now, for prevention, we know there are vaccines available, right? So we have, let me go back to the previous page so we can see which ones have vaccination. All right, so back to table 43-4. So we discussed that A and E are both oral fecal. However, between the two, only hepatitis A has an available vaccine. Hepatitis B, you know, we have a vaccine for. C currently does not have a vaccine yet. However, if you look at D, now D can only be acquired if you have a previous infection of hepatitis B, meaning D cannot enter your cells unless it gets, because this is a reverse RNA virus, so it needs the help of B in order to enter the body. Okay, so let's say you were exposed to hepatitis D. Let's say this is a transmitted through body fluids, you know, through blood and needle injections or open wounds, for instance. You know, it's a blood-borne disease. Even if you get exposed to this, but you had no prior infection of hepatitis B, then you will not be infected with D. Any question about that?
No.
Okay, that was pretty clear. All right, so you need prior hepatitis B infection before you can acquire hepatitis D. So if I gave you a question that which hepatitis viruses are preventable with vaccines, which will you pick? Let's say select all that apply. Which ones have an available vaccination?
Hepatitis B.
B, what else?
A.
A, what else?
C.
C has no vaccine. I said that there's no
D.
available vaccine. D is preventable because how do you prevent D? There is no vitamin D. I mean, there is no hepatitis D vaccine. However, how do you get it again?
Hepatitis B.
So therefore, if you prevent hepatitis B, are you protecting also against D?
Yes.
Yes. So therefore, is this preventable with a vaccine?
Yes.
Yes. All right. Indirectly. There is no vaccine for D, but since there's a vaccine for B, so indirectly you are protecting against D. Any question or clarification? Very good, children. All right, let's proceed. So again, the test questions on the exam, I won't read the whole thing for you. It'll be discussing, no, you will be tested on transmission. So therefore, if you know how it is transmitted, then you would know how to prevent it, right? So here's the summary, chart 43-5. Here's the prevention for hepatitis A, B, C. Here's dietary management, which will be the same as with any other liver disease, meaning whenever the liver is injured, the patient actually requires high calorie intake. The patient is in a hypermetabolic state. However, the patient also needs a lot of rest. So, however, this chart only discusses dietary management. We'll discuss more on nursing management when we get to the chapter. I mean, the chapter on cirrhosis. However, in proteins, now, why is the patient's protein limited? Because as you can see here, it's restricted, right? It's 1.2 to 1.5 grams per kilogram per day. Now, let's review. What is BUN? What is blood urea nitrogen?
It's a blood test for the kidneys function to see how they're excreting the urine.
Correct. So that's a waste product, correct? So from nitrogenous waste. However, that is eliminated by the kidneys. Now, what is the role of the liver, therefore, with protein metabolism? What is another waste product coming from protein that is destroyed or eliminated by the liver?
Albumin.
It's ammonia.
Ammonia.
Ammonia. Okay, so we have BUN and ammonia. Now, BUN is excreted by the kidneys, ammonia is excreted by the liver. Now, in the case of liver disease, the more protein, I mean, the patient's liver needs to heal. They do need protein. However, you need to limit it in the case of active liver disease, especially when the patient has advanced cirrhosis, for instance, or especially if there is an acute infection like A and E, for instance, hepatitis A and E. So in those particular diseases or infections, the patient's protein need to be limited. Again, they need protein, but it has to be limited because the more protein you give, then the more ammonia the patient will produce, which the liver currently in that infected state cannot eliminate normally. Do you understand? Any questions?
Yes, Professor.
Okay, all right. Now, so please read. This will be a very good select all that apply question. Okay, I can easily make that question in 2 minutes. Okay, copying, pasting, changing a few words. All right.
Right, for the final, right?
Yes, final exam. Any question on hepatitis A? I mean, you should know already to avoid alcohol. Okay, as with any liver condition, alcohol is only metabolized by the liver along with any other drug. Okay. Okay, so here's B. This is transmitted via the bloodborne route, okay, percutaneous and permucosal routes, meaning through a needle prick. Doesn't have to be an accidental needle injection. Could be, could also be from IV drug use, or through an open wound. Okay, so you have a wound in your mouth or your rectum, for instance. So this involves men who have sex with men. Okay, so very high risk for transmission. So similar to HIV. Okay, but unlike HIV, well, HIV is treatable now. We do have Biktarvy, and we even have PrEP now, pre-exposure prophylaxis for HIV. So here are your risk factors. Chart 43-7, so who are at risk for contracting hepatitis B? And these are the patients at risk. So that involves us. Okay, so we are here as we handle body fluids and we handle needles. So we already discussed there is a vaccine. Hopefully everybody did not sign a waiver. You know, everybody is vaccinated against hepatitis B. Now, no matter how careful you are, we cannot prevent accidents, okay? So I've had a few needle sticks in my lifetime. And each time, of course, because I've already had the vaccine, no, you still need to get tested. You report the incident, go to the ER, they'll test you for HIV, okay? Because you're protected against hepatitis B, but then there are other bloodborne illnesses. Okay. Now, in the case wherein the patient or let's say the person exposed, which is you, say you were exposed to a needle stick, and you were not vaccinated prior. So the protocol is you will be given immediate protection by getting the hepatitis B immune globulin. So you get that one shot and then followed by the first of the series of hepatitis B vaccination. Okay, but the important thing is you follow post-exposure protocol. So we can't help you unless you report it. Does everybody understand?
Yes, sir.
All right, so that's your role, okay? So again, needle sticks, they happen, okay? No matter how careful you are, it's the patient. Patients sometimes do not cooperate and then they cause the accident. Okay, so they move and then cause you to get injured. So some things we can control, some things we can't. So there's treatment now for hepatitis B and C. Used to be worse than HIV. HIV had a treatment, and there was never one for hepatitis B. Now we do. I'm not testing on the treatment. Okay. Our role as nurses really should be on health promotion, which includes prevention, transmission prevention. All right, let's move on to C. Okay, so C is one of the highest cases of bloodborne illnesses in the US. Here are risk factors. So similar to hepatitis B, okay, they're both contracted through percutaneous or through mucous membrane transmission. Okay, so that includes unprotected sex. And that's it for C. So it's similar to B. And D, since again, they're similar to B, the difference is you cannot contract this unless you have prior exposure to hepatitis B. Okay, but everything else is the same, including treatment. And here's E. So this will refer you back again to hepatitis A. As already mentioned, they are similar. So just some countries, don't have E and others don't. That's basically the only difference. Okay, but it is an acute GI infection. Okay, so the patient has an acute liver infection and similar to hepatitis A. That's about it for hepatitis. Any questions? All right, let's move on to